Hello, this is Beth Shank, and I'm going to now discuss environmental stewardship in healthcare using the case study of Providence, which is the organization I work with. Providence is a large health system in 7 western states from Alaska to Texas, with actually 53 hospitals now, over 1,000 clinics, over 120,000 caregivers, which is our word for employees, and a significantly large environmental footprint. These are the states where all of our hospitals and clinics are, and most of them are in the 3 coastal states on the mainland. In 2020, on Earth Day of 2020, we announced our goal to become carbon negative by 2030. This is the boldest goal in U.S. healthcare, and it is an enormous task to take on. But for some of these reasons listed here, we decided, and our leaders supported, that this was an important thing for us to address in our commitment to health. Our vision statement is health for a better world, and therefore caring for the environment and doing our part to clean up our own part of the pollution is important commitment. So what do we mean by this goal? There are a lot of different ways that people talk about this. We don't have a shared vocabulary yet in the world, I would say, and people mean different things when they describe carbon neutral, carbon negative, net zero, etc. So I want to be clear about what we're trying to do. We looked at all these options in the first box. Should we address electricity only? Some sites are choosing to address renewable electricity. That is their goal. That's great. It's a hard thing to do, and that's great. Others are saying we're going to take on energy, which is electricity, natural gas, propane, diesel, etc. Mitigate that down and then address the greenhouse gas emissions. Some say they're going to use scopes 1 and 2. So what that means is that's from the International Greenhouse Gas Protocol, how greenhouse gases are categorized in these 3 different scopes, and I'll talk more about that. Energy is in scopes 1 and 2 for the most part. And then others, actually only Providence right now, is taking on all of these. So scopes 1, 2, and 3, and that includes all the direct emissions that we literally burn on our property, and indirect emissions, things that come from our supply chain or from our waste or from our business travel. Then to become carbon negative, we're planning to go a little bit further so that we are at least doing a little bit to offset historical emissions and emissions that are already in the atmosphere. Okay, then next, what is the span or reach? We talked about maybe we should start just with our acute sites. That's 53 hospitals. That's difficult. Or maybe it should be all of our clinical sites. That's hospitals, ambulatory, home health, virtual health, etc. But we have other aspects as well. We have a university, we have a high school, we have lots of long-term care, we have medical office buildings, we have companies, and we have investments. And so we recognize that if we're being responsive to our mission and to our core value of justice, then we can't exactly just do part. So we are obligated, we feel, to include the span of our entire organization. And then what is the time frame? As mentioned, this decade is thought to be pivotal into whether we as humans can keep our temperature, our warming in a manageable range or not. And so we take that seriously. We're paying attention to the science. We know that we cannot put this off. We need to act now. And so we're making this rather outrageous goal to say we want to do all this by 2030. Challenging, but really crucial. All right, so I just mentioned to you about what we meant by our carbon negative, and just to clarify again, carbon neutral often means when a company or organization removes an equivalent amount of greenhouse gas pollution that it emits. Carbon negative is going a bit further. This is just a very high level, easy to understand view of our scopes 1, 2, and 3 and how they shake out. So, oftentimes this is surprising to employees. We think of energy as the big problem, and it is fundamentally because it's the burning of fossil fuels that is the vastly largest piece of what drives greenhouse gases, but it's not necessarily only through energy use. So our energy use is about 20% of our footprint, and all those indirect emissions in scope 3 are where we really see our numbers, and that's because of all the stuff that we buy. Construction goes there into scope 3. All of our travel, our waste, our investments, and more. There are 15 subcategories to scope 3. So that's harder to address, really, because it's harder to measure. We're not in control. It's indirect. It's not directly under our control. We also have set one more goal, and it's the waste goal, and that is to keep send less than 50% of our total waste to landfill or incineration by 2030. Right now, across our acute sites, we're at about 73% is still going to landfill or incineration. So we're trying to dial that down. We have 2 acute sites that are already over the 50% mark. So this is great, meaning less than 50%. So we know this can happen, but it takes a real mind shift. And the biggest thing we're focusing on in the end, after we get sort of the different waste streams lined up and people segregating properly, is really to focus on source reduction. This is an important topic, waste, because it touches everybody. Everybody every day throws stuff away. And also, no matter what I talk about in terms of energy and food and greenhouse gas emissions and carbon accounting, people usually ask about waste. So I know it's top of mind, and therefore it's a real tool for engagement as well as for substantive change in the way we use our products. So source reduction is really a key feature, and one that's harder to accomplish and harder to measure, but we're committed to this. I've mentioned to you in the previous slide about our previous slideshow about our REACT framework. So we're using this across Providence, and this is terrific. And I won't go into great detail on these slides, but this gives you an idea of how we're operationalizing each of these elements. This is a very high level view because at each site and even in each unit of each site, there are things happening in these categories. So waste I just told you about. Our energy and water, our plans are basically to work on all that we can through efficiency. So that's through both conservation and efficient building design and also modernization of our current buildings. That sounds easy, but it's really not. We have old buildings from the 60s and 70s, some of which do not have modern controls. It's very difficult to understand what's really happening. It's not submetered. Lots and lots of challenges here. But of course, that's how we drive efficiency and have a more reliable facilities, et cetera. We think that we will do pretty well with electricity, renewable electricity in these 10 years, but we have fewer options with natural gas. We have old buildings. We're not going to be able to replace all the boilers. We don't have a great natural gas substitute yet. I don't expect that we will by 2030, but we don't know that for sure. And so we will be doing everything we can for efficiency and keeping our eye on options, but we'll probably end up offsetting a fair amount of our natural gas emissions. Agriculture and food, we are focusing on reducing waste, certainly, and also choosing lower carbon intensive foods. And that can be done. There's a lot of knowledge about those choices, and it mostly is impacted by meat and dairy, but there are some others as well. And support local and sustainable foods while also choosing healthy foods with lower chemicals and fresher. So that's our focus with agriculture. With chemicals, I mentioned before about our anesthetic agents and nitrous oxide and refrigerants. Those are the main categories we're working on for climate, but we're also working on reducing chemicals of concern because of their health impacts primarily to the staff. So that's an important piece. Transportation, I also spoke about. We look at 4 aspects of business travel. That includes our flights, rental cars, and hotels, and that's for meetings and calls and conversations and whatnot, and also reimbursed miles that caregivers or employees use in their delivery of care every day. And then secondly, we are working on emissions from our commuters, which is a challenge. One thing we've seen in the pandemic is a 90% reduction in business travel. Now, that doesn't mean that people stopped meeting or that our communications stopped functioning. What it meant is we got a lot better at virtual. And I personally think that's an important way forward. It not only saves the planet or helps save the planet, but it gives caregivers more time, less time in hotels, less time in airports, and perhaps we can meet less frequently through the year to build relationships, but we can really manage a lot virtually. Another piece of our plan, our initiative, is for building health and resilience. We've started an environmental justice collaborative, and this is really to begin to turn our lens toward those issues in our communities that are driving environmentally determined health disparities, because we know that not everyone is impacted the same by air pollution, by heat, by smoke, by proximity to large freeways and intersections, to proximity to industrial sites and incinerators. So that is very well known. There's a lot of data out there, but it is something that we're wanting to take into account in the ways that we interact with our communities. Also, as mentioned, we don't want to be part of this problem. You can see on the right, people come to us for healthcare services. In that process, we're creating healthcare pollution. That drives disease and illness, and people come to us for healthcare services. That's the cycle we want to stop. And so that's an overall piece of our health commitment. In Providence, about 80% of our employees are clinicians or clinically focused in some way, involved in direct care. And these people know how to make the changes necessary in policy, in processes, in the products they buy and use. And so we're really wanting to tap the wisdom of the clinicians. Clinicians are often left out of this discussion. It's thought of as more like a buildings thing or a purchasing thing, but it's really the clinicians who are the key, have the key input in healthcare. And so we're looking forward to that starting in early 2022. Commitment and engagement is really important. We are fortunate to have a very strong advocacy team who is out ahead often on some of these issues. For instance, we were in the founding groups for the Washington Healthcare Climate Alliance and the California Healthcare Climate Alliance. We had helped lobby and craft the Washington Clean Buildings Bill, which is a really important bill that is using a stick approach to get large buildings into more energy efficient terrain. Other examples are the California Edible Food Recovery Act, the Portland Carbon Tax, and advocacy with Montana PSC even. We have a national presence as well. This is important to be out there and leading in all of these different areas. And we're proud of that work and hope that it helps invite other healthcare systems and leaders on board. So this is just an idea in case you're curious about where we are today with our progress. We have a lot to do by 2030, but we are chipping away and with some great successes. I told you a bit about our waste optimization process. For energy, luckily in Washington, we were able to tap into a green tariff, and we started this in 2018. It just came through in 2021. So these things take a long time. But with the flip of a switch after this contract was signed, we had multiple sites, 21 different metered sites that are 100% renewable electricity. So we're looking for large-scale change like that, which is going to be more effective for us than large-scale on-site renewables. Though we do have the largest solar array on any hospital in Washington State history at one of our hospitals. But case in point, even though that's the largest solar array on a hospital, it provides 10% of that hospital's electricity needs. It's just difficult to keep up with the electricity demand. Agriculture and food, I told you a bit about, and we're making progress in those areas. Chemicals, we've already reduced half of our greenhouse gas emissions from the anesthetic agents, and we're working hard now on nitrous oxide, which is proving to be challenging. Business travel, I mentioned that we dipped quite a lot during the pandemic, and I'm really grateful that our leaders have said we want to keep it at 25% of pre-pandemic levels. Leverage these tools that we use for communication and enjoy the cost savings, the money savings from not traveling so much. So in our planning process, I mentioned that our vision statement is health for a better world. And so this commitment statement came out of our planning process that we act together, we act on health for a better world, but we act to become carbon negative together with caregivers on health and justice for a better world by caring for our common home that we will pass to future generations. Thank you for listening to this case study example of environmental stewardship in healthcare for the health system Providence. Thank you.